Good evening everyone, how are you? Hope you are doing good. I am Dr. Sulthan and RASHID, consultant diabetologist at Ammaar in Chennai. Today I am going to discuss about one of the important topic, that is the management of type 1 diabetes. Let's go into the topic. All persons with type 1 diabetes should be treated with insulin. Insulin is the drug of choice in type 1 diabetes. Physiological insulin replacement regimens, which provides both basal and prandial insulin, they are recommended for most persons with type 1 diabetes. So achievement of the glucose targets using either multiple daily injections of insulin or continuous subcutaneous insulin infusion devices, they are needed to prevent the development of life-threatening crises such as acute hyperglycemic crisis, can be either DKA and hyperglycemic hyperosmolar state and catabolic state. A multi-component self-management diabetes mellitus education program is recommended for persons with type 1 diabetes. Individuals should be counseled and educated on the topics of healthy lifestyle and insulin technique, including prandial insulin dosing guided by carbohydrate counting and diet adjustments for special situations such as physical activity and prolonged fasting. Instruction is also needed on how to deal with the sick days and prevention of DKA and hyperglycemia and other relevant issues. The ideal insulin regimen should be personalized to an individual's needs and glycemic targets, attempting to better emulate the physiological insulin replacement to maintain near normal glycemia, to prevent the development and progression of diabetes complications while minimizing hypoglycemia and providing flexibility for specific daily life situations, scenarios such as exercise, sleep, acute illness, and psychological stress. Usually should involve the use of insulin analogs for most persons with type 1 diabetes and include the following approaches. Number one is MDI, multiple daily injections of insulin, which usually involves 1 to 2 subcutaneous injections daily of basal insulin to suppress gluconeogenesis and to control glycemia between the meals and overnight. And subcutaneous injections of prandial insulin also needed, or use of inhaled insulin also we can use before each meal to control meal-related glycemic excursions. We can also use insulin pump therapy, that is CSII, provides constant continuous infusion of fast-acting insulin driven by mechanical force and delivered through a cannula inserted under the skin. CSII can improve or enhance glycemic control and should be an option for insulin delivery for appropriate persons with diabetes mellitus. We can also use AIDS, automated insulin delivery system, which include an insulin pump, an integrated continuous glucose monitoring device, and a computer software algorithm which aims to better emulate your physiological insulin replacement and achieve glycemic targets. We can also use open loop, which involves the use of a pump and sensor which do not communicate. We can also use SAP systems, that's a sensor augmented pump systems, which contains continuous glucose monitoring devices which communicates with the pump, facilitating the needed adjustments to basal rate. We can also temporarily interrupt the insulin delivery when glucose levels are low or forecast to be low within 30 minutes. An insulin pump with a continuous glucose monitoring devices or an SAP is recommended to manage patients with diabetes treated with the intensive insulin management who prefer not to use automated insulin delivery systems or have no access to them. Thank you so much for your kind attention, and kindly share my lecture to your friends.